Hi, I'm Dr. Henele, and we're here again to talk with you about release point therapy. We're still in the superficial fascial expansion, but we want to show a new technique within there. And this one is called fascial walking. So we started out previously with the fascial hold, where we were able to get a good hold on the soft tissues of the body and create a breath response. You can do this anywhere in the body. We do it everywhere in the body, whether we're talking about legs or hips, over the thoracolumbar fascia, base of the neck, forearms. If you're a body worker, you should come in and have your forearms done. You'll love it. I mean, there's nothing better that I've ever seen for people with a lot of tension in their forearms, or tension in their feet like dancers, or tension in their low back like lawyers. So with this, we want to say, we want to keep the fascia expanded because I want to keep the breath moving. How do I get from the elbow up to the shoulder? How do I cover this whole surface area to make sure that in this case, the tricep muscle, we've gotten all these superficial scarring out? Well, it's done like this. Everything starts out as a hold, so remember the triangle. You lay your palms flat, engage your thumb and your forefinger, drop the heel of your hand down. That keeps a good, let's see if we can get a good breath response here. That keeps the breath moving. There we go. Now I'm messing with my lift because there we go. I didn't get the breath response that I wanted yet. But now I've got a really good expansive breath quality. I know the depth that this client likes. So now what I have to do is maintain that depth. Now with this technique, we want it to be very smooth. So come a little bit closer. Take a look over my shoulder at the thumbs. We want the technique to be very rhythmic. That's why we have music playing. Very smooth, so that it's like a caress. You might see similar techniques in other systems called kneading or things like that. The different dynamic that we have in this system is that, number one, our palm is almost always in contact with the tissue, so that we establish an energetic connection at all times between our heart energy and the energy fields of our client. Secondly, though, one of the things I've seen in other systems is that they'll get a lift, they'll work the tissue, and then they'll drop the tissue down and start over. And they move and move and move by lifting, dropping, lifting, dropping, lifting, dropping. The problem with that is that it doesn't allow for a flow and to keep the parasympathetic nervous system engaged. It throws off the breath rhythm. So what we want to do is get a good hold and always maintain the hold in one hand, even as you are, in this case, sidestepping. That's the kind of walking we're doing. So I'm sidestepping up the arm. My left hand continually gets the hold. My right hand comes in, thumb presses into the tissue, and then draws back as if I'm getting another hold. Left hand comes in, the thumb, look at this, smooths into the tissue. What this does is, this hold in my right hand is bringing any scar tissue right to the forefront. My left thumb now is coming in and cleaning that scar tissue up and then re-engaging the hold. Right hand, I walk a little bit off, sidestep a little bit. Thumb comes in, cleans up any scarring, any crunchies that we feel, maintain the hold. Left hand does the same. So that eventually what it looks like, folks, is this. And listen to the sound of my breath, very important. Everything is fluid. Oh, I found a hard point right in here. I may not try to force this technique. What I will go into is an acu-lifting. So I'm on a meridian right now, in this case the small intestine. I'm holding the meridian through the tissue and I'm lifting away. I feel tension in here. I'm lifting away from where I feel that tension so that I can engage that fascial line. I'll show you what I mean in our next snippet. But one of the things I want you to notice with this walking technique is that we walk to clear scar tissue, and we also walk to find places of tension so that when we find that tension, we can go back into the original fascial hold or acu-lifting if you're that advanced.
A question.
Yes?
What might the scar tissue feel like?
Good question. Scar tissue will often feel like crunchies under the skin. And sometimes we go over an area and it's like, oh, that was crunchy. And then you go over it and it's not there. That's how you know you cleared the scar tissue out, because the crunchies go away. Sometimes you go over area and it's a little crunchy and then the crunchies are still there. That can be a denser form of scar tissue, or it can just be some anatomical structures that you're going over, maybe some adipose tissue, stuff like that. So it's important to distinguish it. And you distinguish it by always going, hey, it was there and now it's not there. Where did it go? You broke it down. And in breaking it down, you helped enzymes from blood vessels get into the area and further that breakdown even after your session is done. It's what we can set people up for a healing reaction. And you know blood's getting in the area because you can see the tissue color change. All right? But again, what's our rule? If you're forcing it, you're doing it wrong. That's it.